Welcome to our second nurse training lesson, all about general health evaluations. We'll review the steps involved to make sure you can complete the process with confidence. General health evaluation, or GHE, are completed for in-home clients about every 6 months. The office will let you know who will require a GHE for each month. It is your responsibility to ask as well. So make sure around the first of each month, you reach out to offices you work out of to ask which of your clients need a GHE that month. The GHE form is a form from DHSS. This is what the General Health Evaluation form looks like. You can find a copy of it in your nurse training binder. All GHEs are due by the 15th of each month, so make sure to get your list and get them completed by the 15th. This form, once completed, will be sent to the state as the assessment they use to determine if eligibility is met. A scoring system is used, and an LOC, or level of care, of 18 must be met for the client to continue to receive services. Please remember this as you are filling it out and be as descriptive as possible. This is the body diagram sheet to be used when doing GHE assessments. You can find this form in your nurse training binder. This document is the body assessment chart. Please see a copy of it in your nurse training binder as well. The purpose of a GHE assessment is to explain to DHSS the client's needs and the types of assistance the client can receive by our company. So documentation is key. Never leave anything blank. If there is any reason the GHE cannot be completed by this time frame, please notify the office so they can change this in the schedule. If you make an appointment with a client for a GHE visit and they are not home for the scheduled visit, please fill out a missed visit ticket and notify the office so the schedule can be changed. If you are having issues reaching a patient to make an appointment with them for a visit, please reach out to your office and let them assist you in getting in touch with them. When completing a GHE, please ensure that it is properly filled out. Each section needs to be gone over with the client. This is where the nurse will have to sometimes dig for information. No, this doesn't mean to exaggerate what the client says. This just means that the nurse must build rapport with the client, so they feel more comfortable talking about these things. Here is a copy of what we call the GHE cheat sheet that is in the HCBS manual. This is assistance from DSDS on understanding how to score the GHE properly and the criteria to meet that score. You will see that there are 2 sets of eligibility criteria. However, we want to only focus on the transformed criteria, which are pages 1 through 7. This is the new GHE document we are currently using. Please review this before completing a GHE to get yourself familiar. Let's go over a GHE. Participant information. The patient's information should be pre-filled in by the office. Don't forget to date it in the top right-hand corner. Provider nurse information. This is for your name and our provider's name and number. Reason for nurse visit. The first box will be completed for you by your office with semi-annual nurse visit checked. If this is an annual personal care, 6-month GHE visit being completed. You will then check the 6-month review for APC as well. Healthcare information. Please ensure we are asking for all doctors the clients visit, even if it's once a year. Ask about specialty doctors also, such as mental health providers, cardiologist, gastroenterologist, neurologist, endocrinologist, or podiatrist. Make sure to ask clients for all their allergies, especially to medications or latex. This is where you will chart their vital signs as well as on your nurse visit ticket. Cardiopulmonary assessment. Ask each of these and just check which one applies to the client. Integumentary assessment. This is about their skin. Do they have any open sores, rashes, breakdowns, wounds, or torn skin? Along with this, you will complete the body diagram and body chart forms. If there are no skin concerns, then check no concerns and place a line through the 2 forms indicating no issues. Fill out top information on these forms as well. Now this is where the questions really begin. Remember to read each section and the scoring available. Please get yourself familiar with these sections because this can help make the process smoother for you and the client. Level of care determination. Behavioral. Do they receive monitoring for a mental health condition? You should ask the client. Do you have any issues with anxiety, depression, or bipolar disorder, etc.? If no, then later ask about their meds and see they take 2 medications for depression, then they more than likely have a mental health diagnosis. This would be scored on stable or unstable. Do they see a mental health provider? This will give them a score as well. During your visit, are they exhibiting any signs of mood or behavioral symptoms? Cognition. Ask the client, so do you ever forget things? Need reminders? Do you have a POA or guardian? If so, write the person's name and phone number down. Do they have anyone that helps them make financial decisions, such as remembering to pay bills? These are all cognitive issues. Do they have any deficits with decision-making, especially new decisions or cognitive skills? Mobility. Do they use a cane, walker, wheelchair, scooter, or do they require human assistance like someone to hold their arm going up and down stairs on uneven surfaces or getting in and out of the car? Do they hold walls or furniture inside the home but outside they need help? Do they need occasional help to get up or down from the bed or recliner? If they are in a wheelchair, how much assistance is needed for locomotion? Any assistance receives a score. Eating. Are they able to physically feed themselves, or do they require someone to be present while they eat due to choking hazards? Are they on a doctor-prescribed diet, such as low sodium, cardiac, renal, low fat, or diabetic? Do they receive tube feedings or TPN? Toileting. This one can be tricky. You will need to ask, do you ever have issues getting to the restroom on time? Do you ever have accidents? If they say yes, then ask how often. Do they need assistance getting on or off the commode, urinal, or bedpan? Do they require assistance cleansing themselves, adjusting clothes, managing incontinent episodes? Any assistance will receive a score. Bathing. Does the client need any help getting in or out of the tub or shower? Do they need help washing their hair? Do they have someone there because of safety concerns or to be present in case a fall happens? All these will receive a score as well. Dressing and grooming. Do they require any assistance to dress themselves, such as putting on shirts, socks, pants, shoes, or need help brushing their teeth as well as brushing their hair? Do they require any assistance with daily grooming tasks? Rehabilitative services. Do they receive any medically ordered rehabilitative services? Do they receive physical therapy, occupational therapy, speech therapy, or cardiac therapy? If so, how often? All these will give them points. Treatments. Do they require any treatments such as the following: catheter or ostomy care, tube feeding or TPN, suctioning, ventilator or respirator, any wound care on broken skin? All these will give them points. Meal preparation. How much assistance does the client need to prepare meals? Do they require someone to cut up food, open cans or jars, peel potatoes, assemble ingredients to cook, help them plan, or setting out the food? Do they receive any meals brought to them by a nutrition center such as Meals on Wheels? All these will give them points as well. In the next training video, we will look at medication and safety. This will complete the GHE assessment.